Nam from the Computer Game Design Program at George Mason University. Now, Professor Nam and I have a long history too. Perhaps too long to share it all here, but it was again the technology that kept us in touch. Professor Sang Nam will be speaking to us today on digital therapeutics, innovating health using digital devices with games and gamification. Please welcome him with a warm applause.
Thank you. I have my phone here, and I'm going to use it as my timer, because I tend to speak usually longer than my given time. So I'm going to start my timer for 30 minutes now. Before I start, I want to do like little exercise, or I want to have some conversation to understand like who you are as my audience. How many of you guys like dinosaur? Raise your hand if you like dinosaur. I see some hands. That's good. And then my next question is, how do we know dinosaur really existed? How do we know? Anybody? Like, how do you know the dinosaur existed? Yes?
Stories.
Stories. Okay. And what else? Fossil. Yes, fossil. So now, I want you to do me a favor. I want you to take out your cell phone and take a selfie of you, or take a picture of this banner, or me, or anything. And I want you to do that and post this on your social media and like leave something, so that we are creating this digital fossil. So 50 years later, or 100 years later, or even like long time later, people will find this digital fossil and know, like back in 2022, people actually gathered in Dongmyeong University and talked about these great things about game. All right. And I will start my presentation. And you probably see me like doing this because I'm kind of old, so kind of hard to see what it is. Let me try. Okay. Okay, who's this guy? Okay, Sang Nam, that is my name. And I'm an associate professor of game design at George Mason University. And I'm also a director of computer game design program, which offers a BFA and master's degree in computer game design. My 15 minutes fame probably when I was selected as National Teaching Scholar back in 2010. And other things, I am a US Army ITES SW2 contract holder, meaning I am eligible to work with US Army to create the software solutions. And ITES SW2 contract, the whole amount is $13.2 billion, and I am one of 32 contract holders. And also, I am a US Fulbright specialist, so I sometimes go to third world country and try to share my expertise, especially on game design and development. This year, I traveled to Tunisia in North Africa. I worked on capacity building in game design and development, and also I created virtual reality platform and app and game to highlight their historical site. So that's a little bit about me. Actually, this might be old PowerPoint. Let's see. So today I'm going to talk about digital therapeutics, and then funding opportunities and funded projects in US. And I'm going to talk about the regulations in US and gamifying DTX and RedBub. So first, digital therapeutics. why does it matter? I mean, it matters because, many reasons, but sometimes it's easy to talk about number. So if you take a look at the number now, like 2020, the market size $1.2 billion, and 2021, $1.5 billion. And there are many predictions out there, and it's hard to say which one is right, but this is one of many predictions that it will reach probably more than $10 billion by the year of 2030. And then another thing is, while preparing for this presentation, I particularly selected this image because it actually gives you that color code. Diabetes, obesity, CVD, respiratory disease, smoking, and CNS disease, and others. So you can actually see those are kind of hot categories where digital therapeutics research is conducted now. And another thing is global digital therapeutics market. Okay, 2020, $5.09 billion. 2030, $32.5 billion. So this is like a market forecast, including compound annual growth rate. So if we apply that, the market size will be even bigger. So now, like you probably understand, yes, like a lot of companies and a lot of people like look at this as an opportunity because the market size is so big. And let's think about the definition of digital therapeutics. Digital therapeutics deliver therapeutic interventions directly to patients using evidence-based, clinically evaluated software to treat, manage, and prevent a broad spectrum of behavioral, mental, and physical diseases and disorders. So this, again, these days, I have to admit that I use Google sometimes, most of the time. I type digital therapeutics definition, and you'll get like many definitions. Okay? And then I went through a couple of them, and then this is one of the best definition by Digital Therapeutics Alliance. Because actually this one is an old PowerPoint. But here, as you can see, I want you to focus on like evidence-based, clinically evaluated. Okay? So these are kind of very important terminology because that defines what digital therapeutics really are. And anyways, when we talk about digital therapeutics, and then actually for the title of this presentation, I wrote digital health. So there are many definitions out there to to treat this area of research. And then I kind of want to point out that there are these terms, digital health, and digital medicine, and digital therapeutics. They're slightly different. As you can see, digital health would be the broadest term, and then digital medicine and digital therapeutics. So digital health, if there's any game that claims, oh, it will help you something for your, it will make your health a little better, that would be digital health. For that to be counted as digital therapeutics, that should have evidence-based, clinically evaluated study or research. So again, when I prepared this presentation, I assumed that this will be your reference. So I left that URL. So if you want to know more about it, you can definitely visit and get to know these things. And digital therapeutics ecosystem. Okay. This will give you a little kind of broad overview of who really work on this digital therapeutics. Due to limited time, I'm not going to spend spend too much time on this. But again, at your leisure, try to visit this website and try to get to know more if you like to. And digital therapeutics applications, they could have been app, wearable devices, telehealth, like a hospital at home, decision support algorithms, big data, electronic health records, and precision medicine. So there could be many, many applications from this digital therapeutics. And now let's talk about funding opportunities and funded projects. I'm actually talking about funding opportunities and funded project in US to illustrate the current trend or global trends in digital therapeutics. So it might differ the cases from Korea, but I hope you will see this. Oh, US is one of the leading countries on digital therapeutics, and probably other countries like Korea or any other countries will try to follow that trend. Okay, timing is right. The field of digital device used for wellness and therapeutics is growing exponentially. Again, I showed you that market size prediction. It grows really, really fast. Okay? And if you look around, there are many companies actually trying to create or penetrate in this market. In Korea, recently, like Kakao, like one of the big company, Kakao recently create Kakao Healthcare. And then they actually create the digital health like a division. And there are many patients and conditions that can be served by these novel technologies to allow patients to gain insights into their real-time health, provide cognitive behavioral interventions, and provide pain relief. Thus, there are more funding opportunities available. So, in US, you probably heard about NIH, National Institute of Health. This is one of the biggest funding agencies in US. And then NIH has many sub-institutes. So I listed some of them, okay, that actually are actively funding digital therapeutics project. National Institute on Drug Abuse, and National Cancer Institute, National Institute on Aging, National Institute on Alcohol Abuse and Alcoholism, National Institute on Mental Health, and Office of Behavioral and Social Science Research. So those are leading institute or government agencies within NIH funding digital therapeutics projects. And workshops and activities. I'm a game designer and game researcher, and not necessarily digital therapeutics researcher, but I was introduced to this field by one of the workshops hosted by NCI. So I am like one of participants in the NCI's first database and cancer workshop. They actually invited 30 participants for this workshop. So they invited 10 game designer and developer, and 10 physicians, and 10 the patient advocates. So what they do is they put these 3 different professions, and then they ask us, what can you do using these new technologies to make patient experience better? So we talk to one another. Okay? Physicians talk about like what would be the best way to increase or improve patient experience. And we, game designers and developers, we talked about how we can potentially use game or these new digital technologies to make this experience better. So this is an example of many workshops done by these funding agencies. they actually kind of encourage researchers out there to propose a project so they can fund that project. In fact, I am in the process of proposing one digital therapeutic project. So I am planning to work with one of the hospice center in the general hospital to create digital therapeutics game for for pain management, especially for late-stage cancer patients. But again, whenever I talk to the NCI about it, they actually came to see me and then advise and guide me to complete the proposal. And the next slide. And then this is again like National Institute of Health, and then there's HEAL initiative. So this is one of the web page that NIH has. They actually list all the funding opportunities for digital therapeutics. Particularly, there are many pain management funding opportunities. Maybe they want to see how we can use game or apps or these new technologies to decrease usage of pain medicine. And again, if you are curious, you can visit that website by using that URL, heal.nih.gov/funding/open. And funded project by NIDA. So I want to kind of talk about a couple of them. Okay? These are famous projects funded by NIDA. So Pair Therapeutics, SUD and OUD behavioral health app. So they basically using digital app to manage the substance abuse disorder. And there's UBOT, intelligent mental health chatbot. By talking to this intelligent chatbot, there could be some solution or treatment to manage people's mental health. And Ray Health, real-time physiologic monitoring and insight. And Applied VR, relief of chronic pain. So Applied VR is something that I'm very interested in because Applied VR using the virtual reality headset. So by using this interesting scenery in virtual reality, they believe they can reduce the usage of painkiller for many chronic diseases. And then they actually work with General Hospital in California, Mount Sinai. And then I read their paper, and I actually don't believe that data. So that's why I'm kind of interested in this study too, because data looks pretty good, but then again, I have my own doubt. So it kind of drives me to think, oh, how I can study that area as well with my own research. And there's Spellbound, AR, pediatric to increase mobility and distract from pain in hospital, and Lumiscope, AR for healthcare training. Okay, actually this is an old PowerPoint, and can I get somebody to switch it to newer one? Well, we can, I'll come back to it, but okay. I'm going to talk about regulation, and I'm going to come back to this. Okay, regulations. I mentioned this before, evidence-based and clinically evaluated. This is really important. Digital therapeutics, again, by its definition, deliver therapeutic interventions directly to patients using evidence-based, clinically evaluated software to treat, manage, and prevent a broad spectrum of behavioral, mental, and physical diseases and disorders. Again, evidence-based, clinically evaluated. So that's what they are looking for. In US, FDA, Food and Drug Administration, they regulate all these matters about this digital therapeutics. And they're looking for evidence-based science and clinically evaluated. I briefly mentioned about applied VR, and I kind of doubt the data. I'm sure, actually, I'll take back what I just said. They produced great paper, like how virtual reality can reduce this pain in many patients with chronic disease. But then again, I kind of want to see more like a clinical research to solidify their findings. So FDA, this one I'm going to skip some of them because this is something you can actually read at your leisure. Okay? So FDA has a lot of departments within the organization. And then Digital Health Center of Excellence. They are the body that regulate all these digital therapeutics or devices, that intervention devices. So their goal, empower stakeholders to advance healthcare by fostering responsible and high-quality digital health innovation. And they aim to connect and build partnership to accelerate digital health advancement and share knowledge to increase awareness and understanding, drive synergy and advance best practices, and innovate regulatory approaches to provide efficient and least burdensome oversight. I can actually talk like 30 more minutes about just this, but one thing I want to point out is FDA, good thing about FDA or any other other government agencies in the area, in this category, they actually want to advance this area as well. So a lot of times, like we have this preconceived notion about regulatory agencies. Oh, they have to regulate what we do. So they want to actually, they want to make more rules and more regulations so that we cannot really do what we want to do. Actually, no. FDA is very open place. They actually are willing to help anybody who wants to create digital therapeutics intervention device, and they actually want to partner with them, and they want to share knowledge with them, and they want to actually provide more services. In that sense, they actually have this on their website, Digital Health Policy Navigator. So if you go through that list, they actually provide these 7 steps. So each step, they have a question. Is the software function intended for a medical purpose? And then you can actually choose either yes or no. And then if your answer is right, it will actually let you advance to the next step. Step 2, is the software function intended for administrative support of healthcare facility? And then if you say something, and then actually there's each question has this each point of stop, and they explained whether what your software is doing is right for digital health or not. So this is a great service they offer for anybody to create digital health intervention device or software. And gamifying DTX. Can you switch my PowerPoint to a new one? Okay, so gamification. Other speakers actually talked about gamification, so I'm not going to talk much about this. But there's another one, yes. Final. It says final. Okay. So this one is pretty much the same, but yes. So this one's a pair therapeutics. Apply VR. This one, you can actually go to Digital Therapeutic Alliance members page, and then can you play the video? And you will see their members, and then you can actually study what they're doing. So I actually saw one like Korean company, AimMed. That's a Korean company. They're working on some the digital intervention for insomnia, I believe. So this one, like you will see tons of the companies. All right, let's go to the next. Okay. Okay.
You want to play the video?
Oh no, it's okay. It's good. It's good. No time. I have 5 more minutes. All right, gamification. Is this new one or?
That's the old one.
This is the old one?
I think so.
Yeah, I need a new one. I need a new one. This is my alarm. Now I have 5 minutes. Okay. Yeah, this one's good. Okay. Yeah. All right. I only have 5 minutes, so I'll kind of jump. Okay, gamification. Okay, really important. But I'm sure you know what it is. So it helps making behavior change easier and more fun. And there are tons of game mechanics use it in this process. And these are examples. Okay? And now, does it really work? I think that's what people kind of keep asking. We kind of know it's important and that it would work, but does it really work? So evidence-based, clinically evaluated. We think it works, but we need to more evidence-based science and clinically evaluated research. Let's be honest. Does it really work? Can we really ask people in need of medical attention to play games? We really have to think about this. Okay, this is kind of hard topic, but I wanted to talk about this. Okay. Post-traumatic stress disorder and games. I am very saddened to witness this tragedy in Korea. Okay. So now, I actually had an opportunity to talk to reporters about digital therapeutics. And one reporter asked, okay, we had this tragedy in Korea, and do you think game can help? So I said yes. I said yes. But I was thinking, I don't want them to write, oh, Professor Sang-nam said, play more games. Okay, I didn't want to. So I actually talked to the reporter and try to kind of euphemize what I said, and then try to explain my rationale. Okay? So post-traumatic stress disorder in games, this is one criteria. Whenever you experience those tragedy, okay, or witness those tragedy, these are something you go through. You might have negative alteration in mood, or you become suicidal, and you think about all these bad things. Okay. One of the most popular treatment is giving people drug. Actually, this one was taken from ketamine treatment. Oh, we can actually trick brain. And then people actually not going to think about these things because that kind of like a ketamine or opioid types of drug. But now, I believe, instead of giving ketamine or drugs to them, I would give a well-designed game to a patient. Okay. So those little things can be, or frequency of thinking of these things can be reduced by well-designed game. Okay? Not just any game, but well-designed game. Okay? Personally, I lost my mother back in 2016 after fighting 2 years of cancer. Right after that, I started playing game actually more because every 5 minutes I thought of my mom. Every 5 minutes I thought of, oh God, I should have done something different. Okay? It was hard. But at least when I play game, not 10 hours straight, but just like a little bit, it kind of helped me. In Korea, they talk about 불멍, right? Fire. I know my time is up, so I'll wrap up. Spacing out while staring at the campfire, 불멍. And then in Western culture, we sometimes talk about like fish tank. People look at fish tank, and then at that moment, we can alienate ourselves from the society or this hard reality, and then just kind of relax. Sometimes we need this. So my thinking is, premise 1, time can help. Premise number 2, a well-designed game can help a PTSD patient not to think of harmful or dangerous thoughts less by alienating the patient from a devastating situation. I'm not trying to addict a PTSD patient to games. I believe a well-designed game in controlled environment can reduce post-traumatic stress significantly and help the stress more manageable. Okay, change is inevitable. DTX is here and is here to stay. Again, change is inevitable, and this is our responsibility as academic researchers and professionals. We have to work on this digital therapeutics or serious game, functional game, or these things, these great games that can bring positive impact, okay, for the next generation. Okay, time is changing, and let's try to change before we have to. Thank you.